So I'm a mental health counselor here, but I have a specialty in art therapy. So my background, I got licensed in creative arts therapy. So I take art materials and I turn them into an expressive way of therapy. I can work with any age range of kids, but we're doing 5 to 21 here. So art therapy is actually evidence-based, so I can take some assessments and I can actually diagnose your artwork. So some kids don't like drawing around here, and they'll say I'm not a good drawer, and I tell them all the time, you do not have to be a good drawer for this. You just have to try, and I will pull stuff out of that artwork. And it's more about the communication part and the processing, like taking this piece of art and what do we talk about with it, what are we here for, and how do we work a little bit harder on it. So that's something that I will use, and it's a little bit easier if the kids come into a counseling session and they're thinking, oh, this therapist is going to ask me a million questions, whereas mine is a little bit more creative and laid back, where you can just draw a picture, blow some bubbles, play in the sand, and then use that as a way to process any of the trauma that you're dealing with or any of the mental illnesses that are brought about. I do have a training in play therapy as well, so for some of the little kids that are coming in here might not sit down and answer questions that I'm asking them, but I can actually interact with them with their play and in their art. And through the use of art and play, I can help them work through any of the stuff that they're coming here for. For older kids, I have all different kinds of wide range materials that they could use, from painting to coloring to murals to self-expression stuff. So I try to vary it based on the age that they're coming in here and make it more adaptable to them, so that they get interested in it. Because I'm sure some 16-year-old boys are going to come in here and not want to do art, but I'm sure I can be creative enough to think of what do you like and then somehow turn it into an art activity to engage them.